Right now, as we work to get more people vaccinated across the state and country, we're giving you the facts and answering some of your questions. Our 9 Health expert, Dr. Payal Kohli, joins us now this morning. Dr. Kohli, thanks so much for joining me. So we asked viewers to send us questions, and Marianne had the first one asking, with the first dose of the Pfizer vaccine, how protected are you until you get that second dose? Can you contract COVID between doses?
So the clinical trials tell us that after just one single dose of the Pfizer vaccine, you have about a 52% protection as compared to obviously a 95% protection when you get both doses. And this protection takes about 12 days after the first dose to really reach the maximum level. We don't yet know, Natasha, how long this protection lasts if you only get one single dose of the vaccine as opposed to both doses. And we absolutely have seen people contract COVID-19 between the first and second dose. In fact, that's how we got this data. And I think one of the concerns is that if you only get one dose, you only have partial protection, even though, a 52% is not bad. It's better than some of the other vaccines out there, like the flu vaccine. But people do let their guard down soon after they get that first dose of the vaccine. And that could actually paradoxically increase their risk for contracting COVID. And we have seen this occur in a number of cases. People think, I have the vaccine, I can now be, a little less cautious, and that could increase their risk.
The next question comes from one of our 9 News viewers, Lindsay. She wants to know what the future will look like with blood donations and COVID vaccines. This is her question. Will everyone eventually get the COVID antibodies over the years?
That's the hope, that everybody gets the antibodies, and the hope is they get it through vaccination and not through infection. We don't know how long those the antibodies to natural infection last. We know the vaccination antibodies last for at least 3 months or longer. But I think in order to slow the spread of this infection, we certainly are going to need the majority of us to have antibodies, and I'm hopeful that these vaccines will help us accomplish that sooner rather than later.
And our last question comes from Chanterelle. She wants to know, is this a vaccine that we're going to need to get yearly, like the flu shot?
Yeah, I think it most likely is turning out to be that way. So if you look at what's happened so far in the last year, we've had emergence of at least 3 different, more aggressive, more contagious mutations. Now, part of the reason we're having so many mutations emerge is because there's so many cases out there, so the virus has a lot more opportunities to divide. We know that the coronavirus doesn't accumulate mutations quite as fast as the flu virus, for which we get a vaccine every single year. So my best guess is that, yes, we'll definitely have to get it at some regular intervals, but it may not be every year. Once we get the spread under control, it may be every few years that we get vaccinated.
All right, Dr. Kohli, appreciate you joining us this morning. And Dr. Kohli is going to be joining us again at 8:30, so you can still text her at 303-871-1491. Send her your questions that you'd like for her to answer.